This video explains what diabetes is, the different types, and how it can be managed through medication, nutrition, and lifestyle. To begin with, diabetes is not just a single disease. It includes 3 types, each with different causes and treatments. One of the main types is type 1 diabetes. This is an autoimmune condition where the immune system mistakenly attacks insulin-producing cells in the pancreas. It often starts with children or young adults and requires lifelong insulin therapy. Without insulin, the body cannot use glucose for energy, and serious complications can occur quickly. Another common type is type 2 diabetes. This form accounts for the majority of cases. It happens when the body becomes resistant to insulin or does not produce enough of it. Type 2 diabetes usually develops in middle-aged and older adults, but it is now appearing more frequently in younger people as well, especially due to obesity and lack of physical activity. There is also gestational diabetes, which occurs during pregnancy. Although it usually disappears after birth, it increases the risk of health issues for both the mother and the baby. It also raises the chance that the mother may develop type 2 diabetes later in life. Now that we understand the types of diabetes, let's look at how to recognize its symptoms. Diabetes often presents with a set of well-known symptoms. These include excessive urination, increased thirst, constant hunger, and unexplained weight loss. In addition, people may experience fatigue, blurred vision, wounds that heal slowly, and tingling or numbness in the hands and feet. It is important to note that many people with type 2 diabetes do not have noticeable symptoms in the early stages. In fact, the condition is often discovered during routine medical checkups. Next, let's explore the factors that increase the risk of developing diabetes. There are several key factors that raise the risk of developing diabetes. Genetics play a major role. If one or both parents have type 2 diabetes, the risk is significantly higher. Some genetic traits can also make people more susceptible. Excess body fat is another major contributor. Fat stored around the waist, known as visceral fat, can interfere with how insulin works and raise blood sugar levels. Lifestyle choices are also critical. Diets high in sugar and processed foods put stress on the pancreas. A lack of physical activity reduces the body's ability to process glucose efficiently. In addition, poor sleep and long-term stress can make it harder to control blood sugar. As people get older, the risk increases. Those with high blood pressure, abnormal cholesterol levels, or a history of gestational diabetes also face greater chances of developing the condition. Now that we know what increases risk, let's see how diabetes can be managed effectively. Managing diabetes requires a balanced approach that includes medication, dietary adjustments, exercise, and monitoring. For people with type 1 diabetes, insulin therapy is always necessary. Those with type 2 diabetes often begin with oral medications like metformin. Over time, additional drugs or insulin may be needed. During pregnancy, women with gestational diabetes may also require insulin to keep both mother and baby safe. Nutrition is essential. A healthy meal plan should focus on foods with a low glycemic index, such as oats, brown rice, and whole wheat bread. Meals should also include vegetables and legumes to increase fiber intake. It is helpful to reduce added sugars, excess salt, and unhealthy fats. Controlling portion size is equally important. Regular physical activity improves the body's ability to use insulin. It is recommended to engage in at least 150 minutes of moderate exercise, such as brisk walking, each week. Adding strength training 2 to 3 times a week can also improve glucose control. Always speak to a doctor before beginning any exercise plan, especially if there are complications. Self-monitoring helps keep track of progress. This includes checking blood sugar levels regularly and keeping an eye on weight. Even a small weight loss, such as 5% of body weight, can improve blood glucose. Routine screenings for eye, kidney, and nerve health are also important to detect complications early. Although managing diabetes is a lifelong responsibility, many people live healthy and fulfilling lives with the right tools and habits. Diabetes can be managed successfully. With the right knowledge and support, most people can live full and healthy lives. Thank you for watching, and we'll see you next time.